how do people usually cope with traumas? One of the common ways we deal with trauma is by distracting ourselves, with food or shopping, alcohol, smoking, social media, games, and so on. These can provide temporary relief, but they don't address the underlying cause of the pain. Another way some of us deal or cope with trauma is by taking psychiatric drugs or medications or sleeping pills. These are like pain relievers. So again, they can provide temporary relief, but they don't address the underlying cause of the pain. So the pain keeps coming back. And so people have to rely on these drugs for life. Also, psychiatric drugs are harmful in the long run. Side effects include increased anxiety and depression, increased suicidal feelings even. Also chronic illness like obesity, diabetes, kidney failure, heart disease, and early death. And then another way that we deal with trauma is through talking, talking to a therapist or a friend or journaling. Now, these can also provide temporary relief, but as some of you may have noticed, no matter how many times we repeat the stories over and over again, the pain is still there. Talking about or writing about the pain is just a way to cope with the pain. It's not a way to remove the pain. So, how can we remove the pain? Before we look into that, we first have to look at how trauma is lodged in the body.